Why is post-anesthesia care recovery and management vital in medical practice, you ask? Well, it plays an integral role in ensuring patient safety and preventing complications after surgery. This includes monitoring vital signs, managing pain, and identifying potential issues that may arise. This phase of care is where patients can be most vulnerable, and it's our job as healthcare providers to ensure they transition smoothly from the effects of anesthesia back to consciousness. Understanding post-anesthesia care recovery and management is crucial for every healthcare provider. Dive into the world of ambulatory recovery, its design, and functions. This is an essential part of post-anesthesia care that ensures the patient's smooth transition from unconsciousness to full wakefulness. The first stop in this journey is the post-anesthesia care unit, often referred to as the PACU. It is designed to be a closely monitored space where patients are brought immediately after surgery to recover from the effects of anesthesia. This unit is equipped with advanced monitoring systems to keep a vigilant eye on the patient's vital signs. The team of expert nurses and doctors are always on hand to manage any immediate post-operative complications. The goal is to stabilize the patient and prepare them for the next stage of recovery. The secondary recovery area is a less intensive environment where patients transition from the PACU. Here, they are monitored for any lingering effects of anesthesia and any potential complications that might arise. This area is often equipped with comfortable recliners and beds, creating a soothing atmosphere to aid in the recovery process. The extended observation unit is designed for patients who require a longer period of observation due to the complexity of their procedure or their personal health status. This unit is equipped to provide specialized care and monitoring for a prolonged period. Transport capability is a crucial part of ambulatory recovery. It ensures that patients can be safely and efficiently moved between recovery areas and to other parts of the hospital as needed. This function is vital in maintaining the flow of patient care and ensuring that resources are used effectively. Lastly, we have criteria-based recovery. This is a system that uses specific discharge criteria to ascertain when a patient is ready to leave the recovery unit. It ensures that decisions are made based on the patient's health status, rather than arbitrary timeframes. These are the key components of a well-functioning ambulatory recovery unit. With these elements in place, hospitals can provide top-notch post-anesthesia care, ensuring that patients recover safely and efficiently from their procedures. How do we manage the common issues in ambulatory recovery? This is a question often asked in the realm of post-anesthesia care. In this segment, we will shed light on the management of several common issues that can arise during recovery. Post-operative pain is one of the most prevalent complications following surgery. The management of this pain is critical and often involves a multimodal approach, incorporating both pharmacological and non-pharmacological interventions. These may include opioids, non-steroidal anti-inflammatory drugs, and techniques such as guided imagery or distraction. Cardiovascular alterations can also occur post-operatively, with changes in heart rate and blood pressure being common. Management strategies here would involve frequent monitoring, early detection, and appropriate intervention. This could include medication adjustments, fluid management, or even more invasive procedures in severe cases. In the context of chronic cardiac medications, it's imperative to have a clear understanding of each patient's regimen. This includes knowing when to hold or resume these medications post-operatively to prevent exacerbating any cardiovascular alterations. Nausea and emesis, while not life-threatening, can significantly impact a patient's comfort and recovery. Antiemetic medications can be used prophylactically or as needed to manage these symptoms. Additionally, non-pharmacological interventions such as deep breathing and acupressure can also be beneficial. Airway and pulmonary complications are another area of concern. These can be managed through a combination of chest physiotherapy, incentive spirometry, and other breathing exercises. Medical interventions might also be necessary, such as bronchodilators or supplemental oxygen. Surgical complications, though generally rare, can pose significant challenges. These can range from wound infections to deep vein thrombosis. The key to managing these issues lies in early detection, immediate intervention, and appropriate referrals when necessary. Temperature abnormalities, whether it's hypothermia or hyperthermia, can also occur post-operatively. Active warming or cooling, as well as monitoring and managing potential underlying causes, are vital in these situations. Lastly, we come to minor complications. These could include things like urinary retention, constipation, or mild allergic reactions. While these may seem minor, they can significantly impact patient comfort and recovery. Management of these complications often involves a combination of medication, patient education, and sometimes simple reassurance. As you can see, managing ambulatory recovery issues is not a one-size-fits-all process. It requires a comprehensive understanding of the potential complications and a tailored approach to each patient's individual needs. It's about balancing the need for effective pain and symptom management with the goal of minimizing side effects and promoting a quick and comfortable recovery. In conclusion, the management of ambulatory recovery issues is a multifaceted process that requires a keen understanding of the patient's overall health, the nature of their surgery, and the potential complications that could arise. It's an intricate dance, balancing pain management, symptom control, and patient comfort, all while promoting swift recovery. Effective management of these issues is key to successful recovery post-anesthesia. Opening. What does it take for patients to resume normal activities post-anesthesia? When we talk about recovery from anesthesia, we often picture patients waking up in the recovery room, groggy and disoriented. But the recovery process extends far beyond that initial awakening. It involves a gradual return to normal activities which is influenced by several factors, including the type of anesthetics used and the anesthesia techniques employed. Anesthetics can have a profound impact on the speed and quality of recovery. For instance, certain anesthetics may cause residual sedation, leading to prolonged recovery times. Conversely, some anesthetics are known for their rapid recovery profiles, allowing patients to regain their normal function sooner. Anesthesia techniques also play a role. Regional anesthesia, for example, can speed up recovery and reduce the risk of post-operative complications compared to general anesthesia. Now let's talk about oral nutrition. Following anesthesia, it's common for patients to experience nausea, vomiting, or a lack of appetite. But getting back to a regular diet is an important part of the recovery process. It's crucial to provide patients with clear guidelines on when and what to eat post-procedure. Generally, patients are advised to start with clear liquids and gradually reintroduce solid foods as their digestive system recovers. But what about bladder function? Anesthesia can disrupt normal bladder function, leading to urinary retention or incontinence. It's essential to monitor patients for these issues and manage them appropriately. For example, patients who have had spinal or epidural anesthesia may need intermittent catheterization until they regain bladder control. On top of these, it's important to remember that the resumption of normal activities isn't just about physical recovery, it's also about emotional and psychological well-being. Patients may experience anxiety, depression, or cognitive changes following anesthesia. Providing emotional support, reassurance, and appropriate interventions can significantly enhance the recovery process. So, when can patients expect to resume their normal activities? Well, there's no one-size-fits-all answer. Each patient is unique, and recovery times can vary widely. Factors such as the patient's age, overall health, the type of procedure, and the anesthetics used can all influence recovery times. But here's the good news. With the right care and management, most patients can expect to return to their normal activities within a few days to a few weeks post-anesthesia. It's a journey, and like all journeys, it has its ups and downs. But each step forward, each milestone reached, brings the patient closer to their ultimate goal, a full and complete recovery. Closing. Resumption of normal activities is a significant milestone in the recovery process. It's a symbol of progress, a sign that the patient is regaining their independence and returning to their daily life. And that, in the end, is what the recovery process is all about. How does recovery and management differ for pediatric patients post-anesthesia? This is a question that often arises in the field of pediatric anesthesia. The first aspect to consider is the environment. The facilities used for pediatric post-anesthesia care should be designed with the unique needs of children in mind. This involves not only the physical setup, but also the psychological atmosphere that is created. It's essential to have a child-friendly environment that is comforting and less intimidating. Decorations, toys, and child-friendly equipment can all contribute to making the recovery room more appealing to the young patients. Now let's talk about the role of parents in the recovery process. The presence of parents can significantly influence a child's response to the post-anesthesia period. Parents can provide a calming presence for the child, offer reassurance, and help in communicating the child's needs to the healthcare team. In many cases, parents are allowed to be with the child as soon as possible after surgery. This not only helps to alleviate the child's anxiety, but also gives parents an active role in the recovery process. Moving on to a crucial element of pediatric post-anesthesia care, pain management. Children's experience of pain can be quite different from adults, and their expression of discomfort can often be nonverbal. It is therefore essential for healthcare providers to be adept at recognizing and assessing pain in children. Pediatric postoperative pain management is a multidimensional approach. Non-pharmacological methods such as distraction, relaxation techniques, and the use of comforting objects can be very effective. Pharmacological methods involve the use of medications like opioids, non-steroidal anti-inflammatory drugs, and local anesthetics. The choice of medication and dosage should be individualized, considering the child's age, weight, type of surgery, and level of pain. An important part of pain management is the regular assessment of pain levels using age-appropriate pain scales. This allows for timely adjustments in pain management strategies and ensures the child's comfort. One aspect that cannot be overlooked is the potential for postoperative nausea and vomiting in children. Antiemetic medications can be administered as a preventive measure, and further management can be done if symptoms persist. In summary, the post-anesthesia care of pediatric patients involves a unique set of considerations. The facilities should be child-friendly, parents should be actively involved, and pain management should be tailored to the needs of the child. Pediatric patients require special considerations for effective post-anesthesia recovery and management, and as we continue to learn and adapt, we can ensure that our youngest patients have the best possible recovery experience. What are the key takeaways in post-anesthesia care recovery and management? As we draw the curtain on this enlightening journey, it's crucial to revisit and underscore the key points we've explored. Our focus has been on the importance of post-anesthesia care recovery and management, a critical aspect of patient care that can significantly influence the overall success of surgical procedures. We started by delving into the design and function of ambulatory recovery. We learned that these areas are meticulously designed to provide optimum care for patients recovering from anesthesia. The post-anesthesia care unit is the first stop, where immediate recovery is monitored. Then comes the secondary recovery area for patients who need extended supervision. For those requiring even more prolonged observation, there's the extended observation unit. All these areas are equipped with transport capabilities to swiftly move patients when necessary, and importantly, the transition from one phase to another is guided by a criteria-based recovery system, ensuring that patients progress safely through their recovery journey. Next, we navigated the common issues that might arise during ambulatory recovery. These include postoperative pain, cardiovascular alterations, nausea and emesis, airway and pulmonary complications, surgical complications, temperature abnormalities, and minor complications. We explored how each of these issues is managed, emphasizing the importance of a proactive, patient-centered approach. We also discussed the management of chronic cardiac medications, underlining the need for a tailored, individualized strategy. Then, we turned our attention to the resumption of normal activities post-anesthesia. We examined how different anesthetics and anesthesia techniques could influence recovery. We also discussed the importance of oral nutrition and bladder function in the recovery process. Guiding a patient towards normalcy is a gradual process, and understanding the role of these factors can help healthcare providers facilitate smoother transitions back to daily life. Our discussion wouldn't be complete without considering special populations, such as pediatric patients. We learned that the recovery and management of children post-anesthesia necessitate appropriate facilities and the involvement of parents. Pediatric postoperative pain management also requires special attention, as children's pain experiences and expressions can differ significantly from adults. In summary, post-anesthesia care recovery and management is a multifaceted process, demanding a delicate balance of technical knowledge, clinical skills, and patient-centered care. It's a journey that begins with the meticulous design of recovery areas, travels through the management of various recovery issues, and ends with the patient's successful return to normal activities. But remember, every patient is unique. Each will present their own set of challenges and require a personalized approach. As we continue to learn and adapt, we enhance our ability to provide the best possible care post-anesthesia, ensuring that our patients recover safely and smoothly with minimal discomfort. With the right knowledge and skills, post-anesthesia care recovery and management can significantly improve patient outcomes. And that, dear listeners, is the heart of our mission: to make a positive and lasting difference in the lives of our patients.